Cervical cancer is the number 3 cause of cancer in women and the number 4 cause of cancer-associated death worldwide.
Cervical cancer is a disease that should not exist. We know what causes it. There's a vaccination, a very safe and effective vaccination available to treat it. Secondary prevention has been used for many years and is highly successful, and that means identifying the problem before it happens.
So if we can identify the lesion in early stage, like that is precancerous, it is very useful, and we can treat that disease. Cervical cancer has taken over from the breast cancer, which was number 1 in India. Now cervical cancer is number 1. We educate all the women at least above 35 to the importance of screening of the cervical cancer, that is pap smear. But sometimes they don't come, they come only after they get complications.
The major obstacle to preventing this disease completely is money, because vaccination is expensive. It's so expensive for low and middle income countries at this point in time that the prevention of cervical cancer depends on secondary prevention strategies. Secondary prevention strategies are those whereby you recognize an abnormality in a small piece of skin on the neck of the womb, and you excise or destroy that piece of skin.
Well, our student teams right here at the University of Utah came together, partnered with industry, and came up with a single, high-quality and global solution to preventing cervical cancer.
Our team started working on this problem specifically because we met with an industry mentor who approached the Center for Medical Innovation. Dean Wallace saw that there was a big need for preventing cervical cancer in women. Synluma is a device we developed for treating precancerous lesions of the cervix. It's a really simple design. So basically it uses heat to ablate or destroy precancerous lesions in about a minute.
I brought this into a project for the Bench to Bedside because I knew John Langell and his program had done some very innovative things. And I thought this would be a great project for students to learn on, as well as to come up with some unique approaches.
The Center for Medical Innovation was created formally about 4.5 years ago, and it was really meant to be a resource to help our students and our faculty innovate and invent new technologies to create low-cost, high-quality healthcare solutions. We quickly found that it wasn't just being able to teach them how to do it through formal and informal education programs, but we had to resource them. We had to give them access to critical products and services necessary to perform in this really unique space.
So here at the Center for Medical Innovation, we are expert networkers. And we use this to pair our students with faculty, with researchers, with companies outside of the university. We try to leverage all of these resources to accelerate innovation.
Some of the most interesting parts of innovation, where the spark really lies, is at that interface between areas of expertise. And so when you bring together people who have a healthcare or medical background with people who come at it from an engineering perspective or computer science perspective, and then throw in a little bit of that extra business school, common sense, practicality, you create new ideas and new opportunities that are otherwise really unimaginable to each of those individual groups. So here at the University of Utah, we are very fortunate to have that highly collaborative spirit here. And that really helps to explain why our students are able to come up with some really brilliant new ideas. Those kind of ideas that everyone, when they hears about them, thinks, oh, that's so simple. Why hasn't anyone else come up with this before? But it's because they're coming from different perspectives, and then there are these little sparks of creativity just fly. And I just love that about the center here.
So oftentimes our teams are composed of medical students, business students, engineering students, faculty, researchers, doctors, and when we put them together in the same room, and everyone's excited about solving some problem, we get results.
We have seen, just in the last 4 years alone, over 48 student companies start up. We've seen 152 new technologies develop in the healthcare sector, and over 90 patents have been filed by our students and faculty working together.
There's only so much you can learn by hearing, you can learn by reading. You need to learn by doing. And when you learn by doing and you meet a challenge, it's not, well, what do I read next? It's, how do I find an actual solution to this problem that I'm facing right now? And the Center for Medical Innovation has every resource in place to overcome those challenges. If you have a problem with regulatory, you can meet with a regulatory expert. If you have a problem with prototyping, you go to the lab and there's an engineer in there willing to sit and work with you and help you to develop your device. It's the experience, it's the teaching, and then it's the one-on-one mentoring you get in every field of innovation. It's not just medicine, it's not just engineering, it's not just business, it's not just regulatory. It's all of those things. And there are people in each one of those fields that dedicate their lives to learning and becoming masters of that material. And when you have access to a person like that, that's invaluable.
We have a simulation and testing space. We use it for training surgical residents in robotic surgery. And we also use it to evaluate some of our technologies, where we do usability studies, where we invite end users to come and test, to touch, to feel, evaluate our devices. We have lots of 3D printers. We have a CNC mill. We have a 90-watt laser cutter, bandsaw drill press, kind of everything that you would need to prototype. And this allows students to do feasibility, to do design development.
So we created the Therapeutic Games and Application Lab. We call it the GAP Lab. And the GAP Lab brings in amazing students from EAE, or Entertainment Arts and Engineering. These are students who know how to code software technologies, producers who bring coders and designers together to ensure that what they're creating are absolutely outstanding quality and engaging for the patient. In order to facilitate and create the student innovator in this space, we give them the tools necessary to go through the entire innovation process, from concept to commercialization. There are some technology innovations out of the Center for Medical Innovation that really are favorite to mine. And one of those is Sinluma. We put together an interdisciplinary team of amazing students who had been specifically educated in the innovation programs that we teach here. They first spent time understanding the problem and then really understanding the landscape. Their solution had to be effective, it had to be low cost, it had to be portable, and it had to be electrical grid independent, because not everywhere are they going to have access to electricity to do this. And in a matter of just 8 short weeks, they went from understanding the problem to developing a fully functional prototype. 18 months after they started to solve the problem, the technology developed by these students is being used on 3 continents to treat patients and to prevent cervical cancer. It was a truly amazing opportunity to watch our team do something at a rapid pace that's having global impact.
There's so much disease in low and middle income countries that we can't do anything about, or that it's hard to do anything about. Cervical cancer is something that we really can do something about, and that we can prevent completely. Anything that improves the delivery of preventive health services is to be applauded, and that's why I think Sinluma is a good device.
The Center for Medical Innovation could focus on specific areas of application, like global health, like creating extremely affordable technologies for the third world to provide health care for people who otherwise can't be served, and then using some of that technology and bringing it back to the U.S. for truly disruptive technology here at home. So there are many different directions in which the Center for Medical Innovation can focus, and I expect that our students will take us in many of those directions, and some of which we can't even begin to imagine.
It's about changing the world through the students that we educate and the impact that they can have regardless of whatever it is they decide they're going to do with their lives.
That's what drives you. That's what's exciting about biomedical innovation, is the potential to impact lives now, and not just one life, not just whatever patients you can get to in clinic that day. It's innumerable. It's the number of lives that you can touch when you can create a new treatment or a new device, or improve a treatment or improve a device. It's really exciting because that potential is what drives you, but it's really hard to expect to reach that potential. But now we're actually seeing that the efforts that we put in, the things that we learned, are actually having an impact now.